Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is April 15th, Wednesday, and this is my daily briefing. We've had a total of 35 cases to date in Missoula, so we're up 3 since yesterday. 33 of those cases were identified by testing, and 2 were epi-linked. If you have questions about what epi-linked means, please take a look at my video from a couple of days ago where we discuss that in depth. We have 24 cases that have now recovered and 1 death, which leaves 10 active cases. We're monitoring 155 close contacts that are in quarantine, and we anticipate that that number will go up as we do contact tracing for our newest cases. The state has had a total of 404 cases and 7 deaths so far. Today I want to talk a little bit about antibody testing. We're getting a lot of questions about antibody testing, and we know that there's a lot of confusion out there. So I thought we'd take a few minutes to discuss this method of testing, what it means, and how it differs from the current tests that we're using, and discuss its limitations also. Right now, the FDA has not approved any antibody test for COVID-19. They did issue an emergency use authorization for one type of antibody test, but that authorization does not mean that it is approved. Additionally, there are over 70 tests that have been registered per FDA guidelines, but they're not approved either. This has created a confusing situation of buyer beware, both for at-home tests and tests in clinics. All of them tout their ability to analyze exposure to COVID-19, but none have successfully gone through the FDA's process. The bottom line, the FDA is still validating antibody tests. Those currently available on the market have not gone through review, and their accuracy has not been vetted. Just yesterday, the FDA tightened the reins after seeing how many antibody tests were out there and how many are not standing up to scrutiny. The challenge of getting a good antibody test is a global issue. We saw this last week in Europe, most notably in the UK, where after ordering 18 million tests, they discovered that the tests failed to provide accurate results. Accuracy is important, and if that means that we need to wait a couple more weeks for the FDA to approve one, it's worth the wait. Let's talk about why accuracy matters. The tests that don't identify immune people could lead to bad data about population immunity, which could really affect decisions about getting back to life as usual. On the flip side, if a test identifies people as immune when they're not really immune, they could also have a false sense of security, stop practicing social distancing, and put themselves and others at risk. There's really just no benefit in rushing this test if we get poor quality data. It's a waste of time, money, and potentially human lives. Now, we should talk about what the antibody test does and doesn't do. We've had people reach out to us suggesting that the antibody test is a solution to the current testing challenges, and that if we could just get our hands on these, we could test everyone and figure out who to put in isolation. However, that's not really how an antibody test works. An antibody test detects proteins formed by your immune system in response to an infection. But these antibodies may not be detectable by the test for 3 to 7 days. This means that a rapid antibody test is a great way to tell if someone has had COVID-19, but it's definitely not the best tool to diagnose someone with an active infection. The antibody test is less likely to identify people with COVID-19 during the period when they're the most infectious. That's why the current test, which detects viral RNA or the virus's genetic material, is what we use for diagnosis. The current test samples the nasal passages and sometimes the throat, and then the sample is processed and the viral genome is extracted and copied millions of times and then tagged with little markers that are specific for COVID-19, which can then be detected. Therefore, when someone has symptoms that are consistent with COVID-19 and the test comes back positive, we can make that connection that their symptoms really are caused by COVID-19. So why is the antibody test important? When we do get an antibody test that is approved and accurate, we can figure out how many people have truly had COVID-19. This is important because, as you've heard, some people can have mild cases, and some are so mild to the point that they didn't even realize that they had it. So knowing how many people may be immune can be helpful in figuring out how to get our lives back to normal. It can also help us answer questions like, how long does this immunity last? How strong of an immune response is needed to fight future exposures? Is the presence of antibodies enough to clear the virus in humans? Those are just questions that we don't have answers to yet. But even once we do have that antibody test, it's a work in progress, and only a validated, widely used test can give us and you the answers that we seek. So in the meantime, please just don't purchase at-home kits to test for COVID-19, and be aware that even antibody testing through clinical sources at this time may be using a test that hasn't been reviewed, standardized, and approved by the FDA. So the other topic I want to touch on is the state report. So the state of Montana issued a report yesterday that showed that as of Friday of last week, 26% of the cases in Montana were community acquired. In Missoula, we're finding that about a third of our cases are considered community acquired. What that means for us is that it shows us that COVID-19 is out there in the community, and the potential for spread in Missoula and everywhere else in the state is definitely there. Some good news is that local public health efforts and the preventative measures that you all are doing out there in the community is helping to slow the spread of this disease. The rate of positive statewide is starting to slow, and the fact that the proportion of the community acquired cases has remained pretty steady shows that our contact tracing and case investigations are working. In addition, the contact and cluster that we were identifying shows that we're finding the people that are most at risk and isolating them effectively so that they're not continuing to spread disease in our community. So thank you out there for everything that you are doing to help us slow the spread of this virus in our community. Again, I just want to remind people that we don't expect to stop the virus at this time. What we're trying to do is just slow the virus spreading in our community effectively enough that we don't overtax our healthcare infrastructure and our resources that we have in Missoula County. So thanks for everything that you're doing out there to contribute to that. That's it for my daily briefing. As always, you can subscribe to me on YouTube. That's under my name, Cindy Farr, CINDYFARR. Click the notification bell so that you get notified whenever new videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department. I just want to remind people that our testing capability has opened up a little bit out at our drive-through testing facility. So anyone who's having symptoms can call 258-INFO, and they can get talk to a nurse, and they can get an appointment to get tested. So call 258-INFO for that, or any other COVID-19 related questions that you might have. Or if you're just looking for resources like rental assistance or assistance getting food, you can call that number and they can direct you to the right people. And you can check our website at missoula.co/cvirus. Okay, so everybody stay healthy, and I will talk to you all again tomorrow.